What if the pills you trust to stay healthy are quietly damaging your brain? Most seniors worry about individual medications or supplements. But the real danger, it's the combinations. The ones quietly interfering with memory, mimicking dementia symptoms, and accelerating decline before anyone realizes. In this video, you'll uncover 10 shocking drug supplement combinations that may be silently causing confusion, brain fog, and even sudden dementia. Edward was 78. For prescriptions for blood pressure, cholesterol, joint pain, and sleep. Then he added a multivitamin. Because everyone's taking them. At first, it was little things. Forgetting groceries, repeating errands. Then one morning, he tried to make toast in the printer. That's when his wife called the doctor. What came next was a diagnosis they feared, Alzheimer's. But the real culprit might have been the pill combinations. Research shows that polypharmacy, the use of 5 or more medications, can overwhelm the body's ability to regulate nutrients. Add a multivitamin on top, and you risk chemical overload, especially with compounds like B6, iron, and folic acid. This can cause agitation, confusion, and even long-term cognitive damage. Most people assume multivitamins are harmless. But when stacked on top of multiple prescriptions, even a small change in brain chemistry can create a tipping point. And often, by the time anyone notices, it's too late to reverse. Susan was 76. She walked daily, ate clean, and followed every instruction from her doctor. A statin for her cholesterol, vitamin D to keep her bones strong. It sounded like the perfect routine. But then she began pausing mid-sentence, responding slower, and sometimes just staring blankly into space. The breaking point. She stood in the shower for 30 minutes, fully dressed, waiting for the water to turn on. Her daughter called the doctor the next day. What most people don't know is this. Statins, while effective, can deplete coenzyme Q10, a compound vital for brain cell energy. Add high-dose vitamin D, and you may further suppress this critical nutrient. The result? A gradual fade in focus, memory, and alertness. One that looks like dementia, but is actually a nutritional shutdown inside the brain. Together, these two healthy substances may slowly drain the brain's battery pack without anyone realizing it. So if your loved one is on statins and supplements, don't brush off fatigue or forgetfulness. Sometimes, it's not aging. It's chemical imbalance hiding in plain sight. Roger was 72, managing his type 2 diabetes like clockwork. Metformin plus a daily insulin injection. Then one morning, he saw a segment on heart health. It praised niacin, vitamin B3, for lowering cholesterol. So, like many others, Roger added it to his pill box. At first, just fatigue. Then, his hands began shaking. His skin turned pale. And during dinner, he tried cooking oatmeal in the dishwasher. His wife booked a neurological evaluation immediately. The finding: dangerous hypoglycemia. Blood sugar crashes caused by the interaction between niacin and his diabetes meds. Niacin can amplify the effects of metformin and insulin, causing sudden drops in blood sugar. In seniors, that means dizziness, disorientation, confusion. These aren't just scary episodes. They weaken the brain's ability to bounce back. Repeated crashes lead to brain fatigue, making long-term memory loss more likely. Niacin sounds like a vitamin, but in the wrong context. It's a chemical accelerant, especially for seniors managing blood sugar. If someone you love is diabetic and using heart health supplements, watch for erratic energy, confusion, or memory slips. Because sometimes it's not the diabetes. It's the interaction that's doing the damage. Billy was 73. She took a diuretic for her blood pressure. And at night, a magnesium supplement to help with cramps and sleep. Simple. Routine. Until it wasn't. First came the blank stares. Then the mid-sentence dropouts. And one morning, she dialed 911, reporting her missing dog, Chelsea. But Billy never owned a dog. Her son drove her straight to the clinic. The problem? Diuretics flush essential minerals, especially magnesium and potassium, from the body. So when seniors try to fix this with magnesium supplements, the balance can swing too far, especially if the body can't absorb or regulate it properly. That leads to an electrolyte imbalance, which studies link to fatigue, slowed cognition, short-term memory loss, and the worst part, it sneaks in slowly. Symptoms are often dismissed as just getting older. But the truth is, the combo of fluid loss and oversupplementation may be draining the brain's clarity, one unnoticed moment at a time. If your loved one is on a water pill and supplements, trust your instincts. When they seem mentally off, the issue may not be age, but the chemistry affecting the brain. Eugene was 74. After his wife passed, he couldn't sleep. His doctor prescribed clonazepam, a benzodiazepine, to ease anxiety. Then a friend suggested CBD gummies. They're natural, he said. Perfect for sleep. So Eugene added them to his nightly routine. At first, he slept better. But then, he stopped showing emotion, became harder to wake, and one evening he walked outside in his pajamas, suitcase in hand, telling the neighbors he was late for a wedding. His daughter called the doctor immediately. Here's the science. CBD interferes with how the liver breaks down benzodiazepines. That means the drug stays in the system longer, increasing sedation, confusion, and memory impairment. Together, this combo can mimic early dementia. Over time, it doesn't just calm the brain. It can numb it, disconnecting thoughts, flattening emotion, making it harder and harder to recover normal mental function. And because CBD is seen as natural, most seniors never think twice. But natural doesn't mean safe, especially not with sedatives. If someone you care about is taking both, watch for personality shifts, emotional dullness, or odd behaviors. Because what feels calming may actually be shutting the brain down. Wanda was 77. Her goal: protect her heart. Her doctor had prescribed a low-dose aspirin as a blood thinner. Then she added fish oil, omega-3, after reading that it could improve memory and circulation. It sounded like a smart move, until she started repeating herself in conversations, trailing off mid-sentence. And once, she got lost in her own driveway, insisting she needed a passport to get back inside. Her husband rushed her to urgent care. What they didn't know: fish oil and blood thinners both reduce clotting. Taken together, they can thin the blood too much, increasing the risk of internal bleeding, including microbleeds in the brain. These tiny brain bleeds are invisible at first, but over time they damage brain tissue, leading to vascular dementia, memory loss, confusion, and reduced cognitive function, caused by poor blood flow. Many seniors take both, thinking they're helping the heart. But what protects the heart might be silently tearing down the brain. If your loved one is on fish oil and any kind of blood thinner, don't wait for symptoms. Ask their doctor if the combination is still right, especially if memory starts to fade. Alan was 80. He couldn't sleep. His doctor said it was normal for his age. So he tried melatonin, the natural sleep hormone. When that didn't help, he added one Benadryl tablet. Just a small dose of diphenhydramine. The combination seemed to work. Until he started sleeping longer. And waking up groggy, confused, and emotionally distant. He forgot family birthdays. Repeated the same question 5 times in a row. But the moment no one could forget, Alan put on 3 winter coats to go to bed. "I need to beat traffic," he said. His daughter called the clinic immediately. Here's what they discovered. Diphenhydramine, found in many OTC sleep aids like Benadryl, blocks acetylcholine, a brain chemical essential for memory. Studies have linked it directly to increased dementia risk, especially when used long-term. Pair that with melatonin, which slows brain activity. And you've got a cocktail for deep neurological sedation. Over time, that can impair thinking, disrupt memory consolidation, and increase the chance of permanent cognitive decline. 2 of the most common sleep aids in America. And together, they may be doing more than putting you to sleep. They may be putting your brain to sleep permanently. If someone you love is using both, especially every night, don't ignore the subtle signs. Because restful sleep shouldn't come at the cost of mental clarity. Joyce was 72. She took calcium every morning for her bones. And every evening after dinner. A PPI, Nexium, for her acid reflux. Simple. Harmless. The routine of millions. But slowly, something shifted. She began to lose track of conversations. Then, she stopped recognizing neighbors she'd known for over 30 years. The moment that broke her son's heart. Joyce called the mailman Dad and invited him in for dinner. That night, the family finally acted. What they didn't know was this. Proton pump inhibitors, like Nexium or omeprazole, interfere with the body's ability to absorb key nutrients, especially calcium, magnesium, and vitamin B12. And these nutrients are essential to brain health. Combine that with a high-dose calcium supplement, and the body may not know what to do. It leads to poor nutrient regulation, neurological fatigue, and an increased risk of long-term memory loss. On paper, it's a perfect combination. Bone health and reflux relief. But in practice, it may starve the brain of what it needs to stay sharp. If your loved one is on daily PPIs and calcium, ask their doctor if it's still necessary before the effects become permanent. Because by the time confusion sets in, recovery isn't always possible. Bernice was 74. She had chronic joint pain, so her doctor prescribed 800 milligrams of ibuprofen daily. Then came a blood test. "You're a little anemic," the doctor said. So she added an iron supplement. 2 common fixes for 2 common problems. But soon, Bernice started complaining of indigestion, feeling lightheaded, and struggling to follow conversations. Her son didn't worry until she tried to butter a sponge, thinking it was a slice of bread. That's when the family demanded answers. What they learned: NSAIDs, like ibuprofen, can irritate the stomach lining, increasing the risk of internal bleeding and inflammation. Add an iron supplement on top, and the body may start to absorb too much iron, especially in the brain. This leads to oxidative stress, a type of cellular damage linked to faster neurodegeneration and memory loss. Together, this combo disrupts gut-brain signaling, impairs nutrient absorption, and can create a quiet, creeping cloud over cognition. Pain and fatigue are common in aging, so these 2 are often taken without question. But the truth is, when iron builds up and inflammation goes unchecked, the brain becomes a silent casualty. If someone you care about takes iron and daily NSAIDs, don't wait for something obvious. It's the small, strange signs that show up first. And sometimes, those signs are already whispers. Of something deeper. Harold was 79. After his wife passed, he started Zoloft, a common SSRI antidepressant to ease the sadness. Months later, a neighbor told him about Ginkgo biloba. It boosts memory, she said. And Harold, like many, wanted to stay sharp. So he added it to his daily routine. At first, everything seemed fine. But then came the emotional flatness, the slow reaction time, and one day, he forgot how to unlock his own front door. His daughter found him sitting on the porch, confused and barefoot in the snow. What she didn't know is this: Ginkgo biloba can interfere with how the brain metabolizes serotonin. And when combined with SSRIs, it may increase the risk of a rare but dangerous condition called serotonin syndrome. Symptoms: confusion, agitation, rapid heart rate, memory impairment, and in seniors, it's often misdiagnosed as dementia. Even low doses of Ginkgo can interact with antidepressants, subtly changing brain chemistry in ways that are hard to detect. Until behavior starts to unravel. Ginkgo sounds gentle, but paired with SSRIs, it can push the brain off balance and keep it there. If someone you love is on antidepressants, check every supplement they're taking, especially the natural ones, because not all brain boosters are safe, and the cost of getting it wrong could be their clarity. So what do these stories have in common? None of them started with sudden dementia. They began with a routine, a vitamin here, a supplement there, and a prescription drug that seemed perfectly safe. But sometimes the danger isn't in what we take. It's in how they interact. That's what no one tells you. And it's why so many seniors and families get caught off guard, blindsided by confusion, memory loss, and behaviors that feel like someone else is living in their body. The worst part: these combinations are everywhere. Recommended, trusted, even praised. But that doesn't mean they're safe. Especially not for the aging brain. If someone you love is acting differently, don't wait for it to get worse. Because sometimes the pills meant to help may be the very reason they're slipping away. And if you found this helpful, you need to see what's next. There's one combination doctors often miss, and it's hiding in something almost every senior eats daily. Click the next video. You won't believe how common it is.